This is a DVD made by the National Institute for Health Research, Mental Health Research Network.
It may come as a surprise to learn that around 1 in 4 of us will have a mental health problem at some point in our lives. That's a lot of people. And yet mental health remains one of the most stigmatised and least understood issues facing our society. It's vital then that we explore new ways of tackling the problem. And one of the most effective ways to do this is through research. If a research study shows that a new treatment for a mental health problem is effective, then the results of that research can be used to persuade the government and the National Health Service to make that treatment more widely available. But undertaking research is often easier said than done.
The stigma in mental health makes it extremely difficult to recruit research participants. The NHS is constantly reorganising, and the NHS mental health services are very fragmented, which again makes it difficult to recruit research participants. There is a high burden of legislative requirements also in setting up research projects, which makes it again difficult to recruit research participants.
But just because research isn't always easy to do, doesn't mean that it isn't being done. Helping to do just that is the Mental Health Research Network, otherwise known as the MHRN. Here at the Network's Coordinating Centre at the Institute of Psychiatry in London, I've come to meet Professor Till Wykes, the Director of the MHRN, to find out more. The studies that the Mental Health Research Network takes on, do you actually do the research, or is someone else doing the research?
The Mental Health Research Network supports research. It doesn't actually do the research itself. So it provides the support costs for research, like trying to find participants for studies and trying to help researchers with access to participants and to clinical services.
Can you tell me a little bit about the aims of the network?
The aims of the network are to try and increase the size of studies, so they make them more multi-centre, because they become more important then. They're more generalisable to lots of services and lots of different people. We also want to increase the number of studies in mental health and to try as far as possible to include as many of the stakeholder interests. I know stakeholder is a bit of a jargon word, but what we really mean by that is to try and involve clinicians to make sure that the studies address important clinical questions, but also to involve service users and carers to make sure that the questions are relevant to their lives.
This need for collaboration and large-scale research permeates the network. Glyn Lewis leads the MHRN's Bristol office. Is the Mental Health Research Network encouraging researchers to collaborate?
The larger the study, the easier it is to answer the questions, and that has been a problem in psychiatry, that a lot of the previous studies have just been too small sometimes to really know whether something works or not. But as well as that, I think what can really happen with the research network is to get both the researchers and the service users and the NHS clinicians all working together. Because without those three groups all pulling in the same direction and supporting the research effort, it's going to be very difficult to carry out successful studies.
The MHRN covers both large and small-scale studies across a wide range of mental health disorders. Belinda Williams is the network's portfolio manager, and I asked her what they are.
We cover all types of studies, including all ages, from children with autism right through to teenagers with anorexia, addictions and schizophrenia, right through to depression in the elderly.
Can you give me an idea of the size of studies that the network supports?
We have studies that are recruiting 10 or 20 patients in just one city in the UK, right through to large-scale studies recruiting 100 or 1,000 patients across the UK.
With all of these studies being covered, it's important that the network has an efficient infrastructure to support research. Across the UK, it partners with similar research organisations in Scotland, Wales and Northern Ireland. Across England, the network is made up of 8 offices, known as hubs. Simon Douglas is North East England's hub manager, and I asked him to describe the idea behind the hub structure.
The idea behind the hubs is that a large-scale project with not necessarily any knowledge locally will be able to use the local knowledge of the hubs to translate it and to work on a local level. We've worked very effectively together. There's 8 hubs, and we constantly in communication if we're all running a project together. So we'll meet by video conferencing, or we'll meet together at a central location to talk about how we're running the project, to share best practice and to measure our performance against each other.
And as a hub manager, what is your role?
My role is essentially to manage the MHRN team in the North East. That involves managing a team of about 15 people, including clinical studies officers, e-science officers and an administrator. And what we do is we engage local clinicians, we find participants for research projects and essentially make sure that these projects run smoothly once they're up and running.
It's quite clear that research is vital. That much I've learned. We've heard about the pivotal role that the MHRN plays in the support of research. But what about the people most affected by mental health issues? That is, the service users and their carers. What's their role in research? To get the answer to this question, I began by speaking to a researcher, Dr. Mike Crawford. So Mike, how would you define service user involvement in research?
It's a term which covers a broad range of different activities conducted by a range of different people. So you have patients and carers and maybe members of the public who might need to access services getting involved in the process of research. And that might be anything from very simple activities like giving some feedback on a questionnaire or a patient information sheet to playing a really central part in commissioning services, conducting research or communicating the findings.
So can you give me some examples where service user involvement has had a real impact on the research that you've been doing?
Yeah, and again, just as I was saying, there's a whole range of different activities. I can think of examples where service users have played a small but really important part, and areas where they've really taken a full lead in driving the research process. On a trivial level, I remember a conversation with a patient where we were talking about how to follow patients up in studies, and she said to me that if you're going to send me a letter, don't send anything in a brown envelope, because I always end up throwing those in the bin. So for this project, we end up using bright blue envelopes, which patients recognise as being part of the study process, and we think we've got a much better response as a result. On the other hand, I've been involved in projects where service users have really taken a central role in collecting data from patients, paid as service user researchers. And there's quite a lot of evidence suggesting that if service users collect data, they might get a more complete picture than researchers who don't have a background of using services.
So what are the benefits of having service user involvement in research?
I think service user involvement helps research become more relevant and the findings can be more generalisable and of more use to people who are commissioning services and people who make decisions about whether or not to use them. But also, service users provide a kind of independent, outsider perspective, which can sometimes really help freshen up a project and make sure that both the logistics of the project and the design of the study are appropriate.
Jo Evans is a researcher. I asked her about the benefits to the service user of being involved in research.
I think people really appreciate actually being involved in a research project. For a long time, participants have been thought of as subjects, and I think it's only more recently that we're talking about full involvement for people. I think to be able to be involved in some research that's actually going to change something for the better for people, especially if they've been in hospital, they probably feel that they haven't had much of a voice. For them to be able to be involved in something that can actually change things for the better in the future, I think is really, really important to people.
At this point, I want to talk to service users and carers. But before I do that, I want to find out just how they can get involved in research.
Well, there are three main ways. You can either contact the MHRN Coordinating Centre by phone, or you can fill out a membership form for service users in research, or for FACTA, which is the carer arm of the MHRN, and both of these membership forms are available online or on this DVD. The third way is to contact your local MHRN hub.
As someone who's responsible for getting people involved in research, why is it so important?
Well, if we don't get service users and carers involved in research, then there's a danger that research simply won't happen. There's also the possibility that the research will be of a lesser quality and won't tell us the things that we need from it. And finally, there's a real risk that the research simply won't meet the needs of service users and carers, and they're the people that we do research for.